the other thing I want to ask you, JP, people often say, you work with people with pain. What do you know about that? Do you have a lived experience of it? And so I'm interested in your lived experience of pain.
Yeah, I think I have two memorable situations in my life. At age of 4, I was diagnosed with Perthes in my right hip. So that was a really changing trajectory in my childhood. There was a lot of pain involved with that. And there was a lot of pushing down and a lot of you can't. And luckily my parents, they took a different approach. They didn't quite like that. And they go, well, we can't, but what if you could? What would that be different? And so I clearly remember my parents talking to the doctors and questioning them. And that felt really empowering, because you go, shouldn't we be listening to the doctors here? And they're questioning them and kind of changing the trajectory. And that really got me to grow up with a picture of myself as someone that can be empowered to do what they want to do. So I lived with pain in that hip for a long time, and funnily enough, the more that I learned, I could actually understand the triggers. So if I am tired, during my PhD, for example, working long hours in the clinic, working long hours academically, sitting on my bum for too long, exercising less than I wanted, having a 1-year-old, that was the time where I had the biggest flare-ups of my entire life. And once that was finished, I can still have flare-ups around that context, but they come and go and they're manageable. But if you take the x-ray of my hip to any reputable surgeon around the world, they'll say, you need a hip replacement. And so that to me is really powerful. And it's often, when appropriate, is a story that I share with patients. But I also had back and leg pain. This is maybe 12 years ago. Actually, I broke my leg, my tibia and fibula. And then I wanted to go back to exercising and lifting weights a bit too quick. And I pushed really heavy, and I probably had a disc prolapse. And I say probably because I never had a scan. But I had quite a nasty leg pain that was affecting my day-to-day, and we had conversations about that. And that was a really tricky moment to live inside a body that was in pain and had knowledge about what I should be doing, but seeing these conflicting beliefs coming up and these ideas or noticing in my body that I had to protect my body, and noticing that I was gaudy, and I was like, what are you doing? So having that experience and having the training and the knowledge allowed me to separate a bit, but often was this tussle between my clinician brain and the experience that I was having. And talking to you at the time and really trusting this side just meant that I never had a scan. I continued being active. I let go of the tension in my body, and I just moved forward. Again, in moments of stress, poor sleep, tiredness, lack of exercise, or whatever else life throws at me, or like a vaccine, or my immune system is a bit suppressed, I can get a snippet of that. Does it stop me? No, because I know that it doesn't mean a threat to my well-being. And that's really, it's really tricky, but it made me really appreciate situations in which patients are in that they may not have the knowledge to be able to have those options.
So those experiences have strengthened you as a clinician from a number of angles. One is around empathy, of understanding that, of understanding the tussles that you naturally face when faced with a health threat. And also the lived experience of learning how to self-manage.
Yeah, the self-efficacy. And so I think having these pain episodes or any other threats to your well-being or day-to-day as a clinician can be really powerful. And reflecting back, and we've written about this, I think it's really important as a clinician to kind of stop and do this. Get someone asking you about your experience and reflecting on how did you respond, how would you respond now, and having an honest conversation, because I think that really translates to what you pass on to your patients. And you may verbally say it's okay, but your body language might say something else. You might have these implicit beliefs because you really truly think that they shouldn't be doing that. because you don't trust it. But you're telling them it's okay. But patients can see that. So I think having that self-reflection is really important.
Thanks for sharing that.
My pleasure.